Hi everyone, Dr. Michael Miyazaki again. Thanks for joining me. Today we're going to be talking about the Endo Sealer Solvent from Vista Apex Solutions. Now what I have seen in decades of doing root canals is that now our sealers are bioceramic sealers. They harden up really well, they adhere to the internal walls of the canal that give us a good seal, and instead of doing a root canal filling it up with lots of gutta percha, now we have the single point gutta percha, the master cone that goes in, and the sealer seals everything up around that one gutta percha. So it really has simplified our procedure of obturation when we do a root canal, but then it also creates an alkaline environment down at the apical end of the root, so there's less postoperative pain and better healing over time. So a lot of us have switched over to these bioceramic sealers. Now, what's the disadvantage? Well, the disadvantage of a bioceramic sealer is that if you have to retreat, it's very hard to get out because it's like basically a cement that's hardened up inside the canal, which is the reason why we don't just fill the canal up with the cement, but we still use gutta percha. The gutta percha, we've talked about this before, creates a hydraulic force to push our sealer laterally into lateral spaces, but it also allows us a way to retreat that root canal if we have to. So the Endo Sealer Solvent was designed to help us retreat a root canal system, because not only do we want to get the gutta percha out and get our sealer out, but we want to make sure we get the sealer out and clean out the lateral canal walls. And so the Sealer Solvent, as you will see, is the perfect answer for what we need today. And the Sealer Solvent isn't just to remove sealer, but if you're doing a 2-visit endo and in between the 2 visits using calcium hydroxide, you could use the Endo Sealer Solvent to more easily and more thoroughly remove that calcium hydroxide. And I'd like to just really quickly go over what the indications for use are of the Endo Sealer Solvent and how to use it. It's an aqueous-based solution comprising a proprietary blend of acids, including citric acid and other surfactants. The unique thing about the Endo Sealer Solvent is that it selectively dissolves the bioceramic sealers, especially important during a retreatment, and calcium hydroxide, which is very important if you're doing a 2-visit endo and you place calcium hydroxide in the canals in between the 2 visits. The important part about this solvent is that it will help to remove the bioceramic sealers and the calcium hydroxide, but it will be gentle to the internal walls of the root canal system, the dentin, and that's the important part. It's a blend of acids, but it's pH balanced, so it can dissolve the sealer and the calcium hydroxide, but be gentle to the dentin. The surfactants in the solution lowers the surface tension, allowing it to wet the surfaces better and then penetrate into the lateral canals and the dentinal tubules. The instructions for use of the Endo Sealer Solvent is very easy. If you're retreating a root canal, what you want to do is you want to remove the gutta percha, reestablish the working length, and then using a clean syringe filled with the Endo Sealer Solvent and an irrigation needle tip, we recommend a 30-gauge Vista probe or Aplavac irrigating tip. When you first start to do this, the fluid coming out of the canal is going to be very cloudy, and as you irrigate it more and get that sealer out of there, it's going to run more clear. Once you get all that sealer out of the canal, or hydrogen peroxide, then you go through your normal irrigation protocols, or if you're removing the calcium hydroxide, just to complete the root canal. Here's an example just showing you a block, having to retreat it, remove the gutta percha. The walls of that canal are coated with the sealer, so we irrigate with the Endo Sealer Solvent and then activate it, and you see how it runs very kind of milky, cloudy to start. And as we do more and more of this irrigation, soaking, and activation, you can see that canal's walls get very clean. So Dr. Ryan Walsh is an endodontist, and he's a great educator also, but he's been using this Endo Sealer Solvent, and I just want to share a few words from Dr. Walsh.
Talking about bioactive materials, bioceramics, and things of that nature. And, but one of the first things that I would get asked is, well, how do you retreat it? Well, before we really didn't have a good answer. We've talked about modern retreatment techniques, and that's been a topic of study at AAE. And I've listened to several very well-known lecturers talk about it. And the bottom line is we just don't have a lot. It's mechanical removal of the sealer to the best of our ability. And what I thought was that, well, we have solvent for gutta percha, but not the sealer. And so I think that's where this really bridges that gap of, okay, we can get the gutta percha out well, but what about bioactive sealers? We've known from several different studies that they're very hard to remove. I mean, at their core, they're medical grade Portland cement. So we put this medical grade Portland cement into a tooth, and not 100% of root canals are going to be successful. And so that small subset that need to be retreated, we have to have effective means to be able to do that. And is having a material or having a solution rather that helps dissolve this material, but is friendly to the surrounding tooth, that's of good value for us endodontists that are, spending, between 20 and 40% of our practices redoing root canals. And we need to have this at our disposal. And like you said, bioactive sealers are becoming, the mainstay. I mean, over the last 15 years or so, they've just continued to grow in their popularity. And so when they start to become retreatment cases in the future, yeah, we need to have something that effectively helps us in that process. Yeah, so it's a citric acid based solution. And citric acid isn't new to dentistry, but the way this has been modified allows it to again be gentle on dentin, which is first and foremost the most important part of what we're doing. But it helps chelate or helps kind of break down some of the bonds that are holding that bioactive sealer together so that once those bonds are broken down, well, then we can then irrigate the sealer back out of the canal. So really simply, it just kind of works very specifically on the sealer, targeting those specific molecules to help release them and break them apart so that we can then flush them back out of the canal space. So on a basic level, that's how it works. Once you get your gutta percha back out of the canal, it then leaves your bioceramic sealer on the wall. And then you introduce your bioceramic sealer solvent or Endo Sealer Solvent. Give it a little activation. I mean, I prefer ultrasonic activation. So use that. And then, yeah, you'll see your irrigating liquid turn just like milk. And that's telling you that it's pulling that bioceramic sealer off the wall and irrigate again. Usually it takes me, I mean, on a one or two canal tooth, 3 cc's, give or take. On a molar that has 4 holes or 5 canals, maybe it takes 6 cc's. But 3 minutes, 5 minutes or so of ultrasonic activation, kind of all together, and your canals are notably visibly cleaner. And we have some studies in the works right now that are supporting that data that it works well to help target that bioceramic sealer and help dissolve it for us so that we can not only remove it from the canal walls to then clean those dentin tubules beyond, but equally to help make sure that we can gain patency, right? To make sure that we can clean all the way to the root tip effectively and then get all those little nooks and crannies that we know are the crux of the bane of our existence to get all that area clean.
All right, well, I hope you enjoyed this information. If you did, hit the like button. If you want to make sure you don't miss any of this information, please hit subscribe. We'd really appreciate it. What we're trying to do with these programs is really develop a network of colleagues where we want to do the very best for our patients. And so we share information to make this possible and to make our clinical lives easier. All right, I'll see you during the next episode. Thank you very much.